So let's talk about what a facelift and neck lift includes. So a facelift is performed to elevate the cheek. In other words, removing the falling cheek upward, and that treats the jowls that form right here. So if you're starting to get jowls, it essentially is your cheek falling down and it sags right here, and that's what forms a jowl. So I like to describe it as a loose hammock. So if you know what a hammock is, or a hammock, however you pronounce it, think of the tissue of your cheek being connected by your mouth and by your ear, and it sort of gets loose and falls down this way and creates jowls. So what a facelift does is it resuspends your cheek tissue up, thereby treating your jowls. So that is what the facelift portion of the operation does. Now the neck lift portion of the operation, that treats the loose skin under your neck. So in other words, the facelift portion of the surgery requires the incision in front of your ear. The neck lift portion of the surgery requires the incisions behind your ear to pull the loose neck skin back and up. So the vectors of movement for the facelift are pretty much vertical and back a little bit on the face, and then the neck is more back and a little bit up. And that is how the facelift and neck lift work together. Lots of patients will come in with bad jowls and they'll say they want a neck lift to fix their jowls. But really what they need to fix their jowls is a facelift, and what fixes the loose neck skin is a neck lift. So that is sort of the difference between the two procedures, and it's also how they work together. So to clean up a jawline, what we need to do is lift the cheek up and pull the neck back, and that sort of tightens up that jawline by pulling the skin in both directions over the mandible. Another thing to remember is that there are many components to facial aging. And oftentimes people need more than just a facelift or just a neck lift to make their faces look younger. Oftentimes people need fat injections to restore volume where volume is lost. You may need a forehead lift or brow lift. You may need an upper eyelid blepharoplasty and or a lower eyelid blepharoplasty. And finally, you probably need a laser resurfacing treatment to smooth out the finer wrinkles in your skin. So the facelift and neck lift serves to elevate the cheek and tighten up the neck by resuspending the falling tissues. That is the purpose or goal of the facelift and neck lift. If you have fine wrinkles on your face, static wrinkles, the treatment for those is generally restoring volume with fat grafting and laser resurfacing to smooth out the skin. Think of the face like a wrinkly sheet. You can pull the sheet as tight as you want, but the wrinkles don't necessarily go away. Sometimes you need to iron the sheet to get the wrinkles to go away, and that is what the laser resurfacing does, is it smooths out the intrinsic static wrinkles of the skin that are not fixed by resuspending the soft tissues to the appropriate level on the face. To learn more, check out our website where you can upload your photos and concerns as a virtual consult. You can also check out our price estimator to get pricing information for all the various procedures we offer. And finally, if you'd like to have your questions answered on a future podcast or Q&A video session like this, please leave a message on our SpeakPipe. You can go to our blog page and our SpeakPipe is located there. Thanks for listening.